Okay.
Been there.
Good. All right, well, thanks everyone for coming. Like Mel said, my name is Luke Gordon. I'm a physical therapist, and I work out in the Valley at Gordon Physical Therapy, so one of the co-owners of the clinic there. And I came about a year ago I came and talked about low back pain? So anyone come to that one?
Yes.
All right. Good, good. So that was about a year ago, and then today I thought I would talk more about different things you guys could do on your own at your workstations to reduce back pain, neck pain, and headaches. So I'll go through my slides and the information fairly quickly and then leave as much time at the end for questions as you guys want. It's a fairly small group, so you guys can interrupt me at any point and just say, hey, what about this, what about that? So we're going to spend more time on neck pain and headaches, but with ergonomics, everything kind of goes hand in hand, and you really can't treat the neck unless you look at the back as well. So I'll just kind of mix that all in. But again, any specific questions, just let me know. So this is what I have in store for you guys today. We're going to start with simple ergonomics, things that you guys can do at your workstation, just real quick, easy things you can do to have a good impact on those things. And then we're going to talk about some other random tips to reduce pain, and then I'll just share some other resources that you guys can also look into for more help. So first up, if my internet works, I'm going to show you a quick video. Didn't you always love a video in class? I don't know if this is actually sharing my screen anymore. I wonder if any of you guys have seen this yet online. Oh, it's not sharing my screen, is it? Technical difficulties. Let's try it again. Oh, man. All right, maybe Jerry will come back later. So the video, has anyone heard of the Upright Go? It's a little device about the size of this clicker that you put on your neck for posture. You guys see that on Facebook at all? Nobody? Oh man, this is not good. So anyways, I'll explain the video to you then. So basically it's a little device about the size of this, maybe a little bit shorter, and they have these office workers and they stick it like right there on their back. And basically, for however this thing works, it's like $50, but when you start to slouch, the thing vibrates. And so it like gives you this little reminder. And so of course the video shows these really happy office workers, and they slouch and the thing vibrates and they sit up and they smile. It's like, wow, this thing is miraculous. And it's really funny because these folks are like sitting like say in a regular chair and they're slouched and then the thing vibrates and they just sit up. Like it's that easy. Like shoot, that's all you gotta do, just sit up, right? No big deal. So anyways, I think it's completely bogus. But people have these things, and maybe it works now and then. Like if you're standing and you're slouching, yeah, you just got to stand up. Fine. But when you're sitting, really, how many of you guys are sitting 8 hours a day, 10 hours a day? Yeah. Could you actually sit up for 6 or 8 hours a day, do you think? If some little thing was vibrating and just reminding you to sit up? Do you think you could do it? Oh my gosh, it would be agony. It would not be good. Are you guys the field workers, by the way, over there? Or are you guys at the desk too? Okay. Got a rugged look to you guys over there. All right. But anyways, even at home, you're sitting, or say you're like on your iPhone, if that thing vibrates, oh yeah, I gotta remember to sit up tall when I'm on my iPhone. It's like it doesn't work that easily. So there are some simple things you can do just to change your workstation that will help you sit up straight for the duration of your work period, but you cannot physically do it by yourself even if your coworker is slapping you or a little thing is vibrating. It just won't work. Spray bottles, stuff like that. It won't work. So there's your video. It was actually like a 40-second video, but now it turned into 4 minutes. And now my computer doesn't work. Where's Jerry?
I just messaged him.
Oh, cool. Let's try this again. Yeah, it's moving on my screen, but not on yours. Hey, here we go. Where to start? So I broke it down into 3 steps, primarily because that's what the PowerPoint presentation came with, was 3 steps. So I said, okay, we'll do 3 steps here. But easily, without a doubt, step 1, if you're trying to reduce neck pain and tension in your shoulders, you want to look at your sitting posture. The best thing you can do is look at your chair. So if you just wheeled your chair out into the middle of your workstation, away from your desk, you're not even thinking about your monitors or your keyboard or anything like that, you should have a chair that fits you pretty well, which you guys still have like the 3 standard sizes, right?
We do, we actually, yes.
Oh, do you have some fancier ones that we don't know about? Okay.
No
So,
comment.
okay. Some $2,000 chairs if you have to really want it. So if you started with a chair and it fits you well, you should be able to sit comfortably with your back way back in the chair, your low back is supported, your feet are down on the floor. Jerry, I think we're okay. Yeah, I think we're okay. We're not going to go back to that video now. I think we're good. So that's how you would start any type of thing to reduce low back discomfort, neck, shoulder strain. So you start with your ideal posture, basically. So if you were sitting there and you had 90-degree angles at your hips and your knees, you should be comfortably supported in your low back with your feet flat on the floor. If you're a little shorter, you might have a footrest. However you do it, your feet should be flat. So when you look at neck posture, if I slouch at my low back, I can't correct my neck. It's physically impossible to correct my neck. So when you're looking at neck pain, headaches, you guys get the tension through your upper shoulders and neck that comes with sitting for that long and reaching and doing things like that. You have to support your back first. So start with your chair. If you've got a good fitting chair, pretty much anything else you can adjust around it. So that's step one. Step two then is your keyboard height. And just a quick show of hands, do a lot of you have Veridesks already? Okay. So in the world before Veridesks, next thing you do is just set your keyboard height. So if you're not using a Veridesk, if you're a little shorter, typically your keyboard height is going to be the way that you'll adjust it by using a keyboard tray so that it fits there and you can stay in an ideal posture. If you're a little taller, you might use the desktop. And if you're a little shorter and you still want to use the desktop, you would just want to use a footrest. So the next thing is keeping your ideal posture in your chair, set your keyboard height so that you can just stay there and you don't have to reach up to get to your keyboard. Does that make sense so far? Cool. And then step three then would be to set your monitors. So most people that I've seen in Avista, which I haven't looked at workstations that recently, but in the last year or two I've done some work for you guys, most of the times your monitors are just really far away. So most people have two monitors here. You got two, they're approximately midline. You want to set the height correctly so the top of the screen is about eye level, but usually they're so far away that if you struggle with vision even a little bit, you're going to end up going like this to look at your screens, and then you get away from your chair and you're leaning on your desk or your armrest, and then your posture is just kind of out the window. So set your monitors. I know you like to have a nice clean looking workstation. You guys are all probably kind of left brain people, so you want to be organized and tidy, stuff like that. But a lot of times those monitors are just too far away. So move them closer, adjust the height up and down. Those two steps get a little trickier with the Veridesk because the keyboard height varies depending on if you're sitting or standing. And then I picked John's brain a little bit on this, and it sounds like when you put the Veridesk up, the monitor relatively is lower than to where it was when you were sitting. So in that case, I believe most of your monitors slide up pretty easily. So slide them up. Does that all sound good so far?
So just a quick confirmation. So the top of the monitor should be equal to your eye level here?
Yeah, so the top of the monitor should be roughly eye level. The other thing with monitors too, if you work on one monitor primarily, like 80% of the time, and the second monitor is more just like where you slide things that you're not working on, you might consider using that primary monitor, putting that primary monitor more into your midline. Because otherwise, if you're spending 80% of the day and it's off to your left and you're looking that way for 80% of the day, that's going to put some interesting stress on your neck too. Most folks I check with tend to use their monitors fairly equally, but again, if you're using one of them primarily and the second one's kind of storage, then you might consider sliding the whole thing to midline. Any other quick questions on that? How to do that? You guys good? Okay. So 4 other tips to reduce some of this pain. These are just kind of random ones. Anybody ever hear this, that sitting is the new smoking? Yeah? What was the point of that? Did anyone have a take-home message for that?
You'll die young if you sit all day.
Yeah, you're going to die. Yeah. So the take-home message was you should start smoking. Option 1, start smoking. Is anyone here involved in corporate wellness? No? You guys are good. You guys are the medical side. No, so that was your first option, right? Because sitting is really bad for you if you sit for too long. So the smokers actually were healthier in general because they got up every hour and they walked way over to wherever that door was to go outside. And then you got to be at least 25 feet away from the door, but you might as well go out to your car anyways and check your Facebook or Snapchat. So they're getting up and they're walking around for like 10 minutes, and then they come back and they've stretched their muscles, the blood is flowing, all of those positive things. So Smokers, to some extent, were healthier than the non-smokers in the sitting setting, which you guys are in. Option 2 then, of course, which is a really boring option, but it actually does work, is just take breaks, like every 20 minutes or so. I don't know how your supervisor feels about that, if you're out there taking breaks all the time, but most folks actually are just as productive even if they take a short break every 20 to 30 minutes. You know, get out, stretch your legs, get a drink of water, something like that. Maybe you could use that little vibrator thing to remind you to take a break every 20 minutes. New invention? Yeah. So sitting is the new smoking. So basically when you're looking at any type of pain, back pain, neck pain, anything like that, taking those breaks really is important. It's just a matter of how you can remind yourself. Would anyone here say they're good at doing that? Anybody? You're good. You're a nurse.
Yeah, we're usually the worst.
You got to get up and get more coffee.
That was my other advice too, is like just drink a lot of coffee or a lot of water because you have to go pee at least every hour. Yeah. No one would actually say they're good at that. You get going on work and you're kind of dialed in. You want to go home at a decent hour. Yeah. Yeah. So, you know, think of little tricks for that. You could be annoying and set a timer on your phone. I don't
A
know.
lot of people have Fitbits and Apple Watches, and they already set reminders for you.
Will it do that? Nice.
Or your wellness on.
Could they get a free Apple Watch?
No.
Yeah.
I can't even use free Apple Watches.
No? Okay. Christmas is coming. Okay, number 2. I'm a tribal kind of guy in many instances, but getting tribal with your coworkers involves just having some shared things that you could do that would help you feel a little healthier throughout the day. Does anyone have an exercise ball, like in their little work area? You got one at home? Okay. Anyone have one at work? Anyone's coworker have one at work? Okay. So do a lot of you have like a cluster of 6 or 8 coworkers, like in your aisle, or 10? Or you guys off on your own? Yeah, so even if just one of you had an exercise ball, you could take turns just kind of sitting on it. You know, you can do like pelvic rolls, you can bounce, you can do all sorts of stuff just to work your muscles a little bit, get a little blood flow. So it could be a shared ball that you guys just kind of once in a while each use. The other thing that I really like for especially neck pain and tension, has anyone ever used any type of like a self-massager for their neck or shoulders? Like a Theracane, you see those big candy canes you can use. My favorite is the Back Mouter 2, which if you go on Amazon, anybody else an Amazon junkie? Yeah, perfect. It's like $30 on Amazon, but it's a big S-shaped massager, and so you can work on some of those muscle knots there too. So preventative, or if you already have some tension, a little more treatment-wise. So get tribal. I'm not saying you have to share lunch or anything, but you might share a ball or a massager. Cool. This is an easy one. We'll kind of breeze through it. Go for a walk. I don't know why I'm picking on Facebook today, but go for a walk at lunch. And then do they still do exercise programs at lunch too once in a while?
Yeah.
You could do that if you wanted to get crazy. Anybody good at that one? Anybody go for a walk at lunch? Yeah? Good deal. All right. You're doing good now. Get a friend. That's an easy thing to do. John's really friendly, by the way, guys.
Thanks.
Yeah.
I don't go for walks though.
Is Hector here, by the way? Hector? No? Okay. No Hector? All right. I had a message for him, but that's okay. And then this is just kind of a general good advice. If you've got pain, consistent pain in your neck, shoulders, back, the longer you wait to get it treated, whether you get it treated by a physical therapist like me, or a chiropractor, massage therapist, in general, the more time you are going to spend getting out of the hole, basically. So again, determine if it's the normal aches and pains, if it's temporary, and if you need to get some treatment, the sooner you do it, typically the better you're going to be, and the less time and money you're going to spend having to do it. So just good general advice. And when you want to look at determining if you need treatment or not, this is how I kind of categorize people. So that first type is if you just have some mild occasional pain, or no pain today, but just occasionally, you can probably just implement some of the tips and stuff I've shared today, and you'll probably be good. So just keep an eye on it. You know, do a little more walking, do some more of those micro breaks. Consider changing up your workstation a little bit. You're probably good to go. Just be forward thinking and preventative thinking. The second one, if you've got moderate levels of pain or it's frequent pain, now that's a little bit different, and we'll talk about that on the next slide. And then the third one is if you have frequent pain and it's like moderate to severe, then you're in a whole other category. So I'll break those down just really quickly here. So if you're in category 1, again, just do some simple stuff like we talked about today. Type 2, again, you've got more moderate pain, it's more frequent. You probably want to implement these tips anyways. That might get you over the hump, and if not, you probably want to seek some additional support, whether it's stretches and exercises, again, working with a personal trainer, a massage therapist, whatever you want to do. Type 3, I would definitely recommend getting some help soon. Anybody here have like back surgery, shoulder surgery, anything like that? Okay. The longer you wait with these things, they just don't tend to go away. I mean, if you've had pain for more than, let's say, 10 days, traditionally, it's not going to go away. So whether you can get rid of it on your own or you need some help, just make the decision rather quickly, in my opinion. And that is, again, a key. Lasting pain, especially if it's moderate to severe, is tending to actually do damage to you. If you get to pain soon enough when it's just more annoying, you're not typically going to have to deal with any damage. It's just irritating. It's inflammation. It's stress. You can get rid of it without having to worry about surgery later on down the line or injections or something more invasive like that. Okay, more stuff. I handed this out on a little sheet, or Melanie helped me hand that out. So if you want any more information, I've got some free reports on my website. So if you want just other information, more detailed information, stretches, things like that, you can click over there. I've got those free reports for download. And then what we do for our patients and then people who come to seminars like this or talks like this is that if you have really bad pain and you want some advice and you're just not sure what to do, so you're not sure if you should do therapy, if you should do chiropractic, if you're actually maybe closer to needing surgery or an MRI or something like that before you try treating it, we're happy to set you up with a free 30-minute consultation with one of our physical therapists. So there's 4 of us. We use that as a tool just to help people make a good decision. So we're not the type of clinic that says, hey, everyone here needs physical therapy if you've got pain. You may not need it. You may need something else. You may have something more serious that we can't help you with. But it's a good way, without having to jump through any insurance hoops or run through referrals or stuff like that, it's a nice way just to get some information. So we just do that for people. We do it actually with a lot of our patients who come in that don't know us yet, just to help them get established and say, look, we're not here to push physical therapy on you, but if you think you might need us, we can help you figure it out. So if you want that, fill out that form I left you, and just come talk to me afterwards, and I'll help you set it up. And I've got my email on that sheet too, so you can email me specific questions. And then I'm not sure about this last one, Una, so you should correct me if I'm wrong. If people need the stuff I talked about, like a footrest or a keyboard tray, do they talk to you?
Yes.
Okay.
They can come to us. We have we're in a place with our ergonomic program where it's really request-based. If you want something, you want to provide it, you want to be proactive in using it. And the other thing about our ergonomics program is it's not so much about standing or sitting, it's about movement. That's what we're trying to push as our goal, is that we want to see people moving more, because we know that that static position is what's kind of the detrimental smoking.
Yeah.
Sitting. So we encourage people to get items that will encourage movement.
Awesome.
Like very good.
Yeah. Well, a lot of your adjustments are simple. Like again, your keyboard is too high. Well, you can lower it with a tray, or you can raise up yourself on your chair and get a footrest. So those things, like Una said, it's basically request-based. So figure it out what you need, and they'll pretty much give it to you, which I always think is a cool thing you guys do.
Yeah, we have a standard list of items. You can't go to Amazon and say, well, I really like this.
Yeah. Yeah.
Because it's obviously there's a budget and we have to consider everybody else. But we do provide a lot of really great equipment that, again, encourages what our program is about, which is about moving. And
Yeah.
I guess to that point, and maybe you can say what you feel about this, but I think oftentimes people think that having a sit-stand workstation, the goal is to stand because that's the healthier thing. But really, they should be sitting and standing intermittently because it introduces that muscle.
Yeah.
Is that correct?
Yeah, I agree.
Okay.
Yeah, you want to go back and forth. The other thing too, standing for prolonged periods without moving, like actually moving, tends to put a lot of pressure on your low back. So yeah, I think sit to stand, you go back and forth. Yeah. Good. So again, for the simple adjustments, you guys can go through Una for those items. I think that's it. Go ahead.
It's my understanding there's different types of pain, i.e. skeletal, muscular, or nerve. Does physical therapy address all 3?
Yes. So the way we approach therapy, and actually when we do our free consultations, what we do is 2 things. We help you figure out what's the cause of your pain. Is it a muscle? Is it a joint? Is it a ligament? Is it a nerve? Is it a combination of any of those things? And then we help you figure out what the best course of action is for you there. So we do all aspects of musculoskeletal pain, which doesn't involve nerves. Yeah. Go ahead.
So I've already gone through the whole desk thing. My desk setup is great. And I've got a sit stand where I sit, sometimes stand, sometimes. My problem right now is driving, particularly with all these cars now having these headrests that lean forward.
Yeah.
I can't get the back position where it doesn't also negatively impact my neck. Do you have any thoughts on posture when driving?
You know, the biggest thing I think with driving is that most people tend to sit back too far, so you're stretching your legs out. And then with your headrests, gosh, I'm not sure. It actually pushes you forward. The headrest does.
You have the back, at a good angle.
Is that your personal car or like a work car?
It's everything I've been in that's new.
Interesting. Okay. I haven't. I'll have to think about that one. I mean, you would say if it's really annoying you, you probably just take the headrest off. But then if you get an accident, that's not a good. That's not a good deal either. Gosh, you could try flipping it around.
Too
See
far back.
if that's better. I don't usually notice mine. Does anyone else have that same problem where the headrest is pushing on them a little bit? A little bit?
Actually, sometimes it just goes forward like this instead of coming straight up. It tends to
Right,
go-
that's how.
Is it a
I've got
newer
two different
car?
cars. Yeah.
Okay, my car is old. Maybe that's why.
What I had to do, I had to tilt the back of the seat back in order to make the headrest not hit my head.
Right, and then,
Yeah.
then my back hurts because it's
Right, exactly.
laying back.
Yeah. So you might then say scoot your seat closer, tip back a little bit, and then use like a low back support, like a towel roll, or they have lumbar rolls like on Amazon too. That's a lot of work though, but it might be worth it, especially if you drive a lot. Any more questions? Can I get my attention? Or go ahead, Mel.
So what if you know that you need physical therapy, but you are a terrible patient and will not do home exercises?
You want to go to one of the other clinics in town, not for physical therapy.
Perfect.
No, I think we get those people, and I always tell them, like, I don't really care if you do it or not, because it's at the end of the day, it's your neck, it's your shoulder. And I was telling a younger patient this week, I was like, you ever heard that old phrase, you can lead a horse to water? And this is a high school girl. She's like, no, never heard. I said, well, you can lead a horse to water, but you can't make him drink. And so everyone's motivated differently. I think if you started therapy, you probably would be motivated to some extent, but
Do you have any programs where you have somebody come like 4 times a week? Or
no.
No.
Well, not typically. You certainly could. Most of our patients come in twice a week, and the majority of work we do, especially for neck pain and headaches, the majority of the work we do is hands-on. So we've got you doing specific stretches. There's a lot of different postural stretches in terms of your neck, and stretching out the chest and the shoulders and getting you back. And then we give you probably more advice on specific ergonomics just to keep you in good posture. But the majority of folks with neck pain and headaches, they need actually hands-on treatment. So we're stretching their necks, we're moving the joints, we're doing deep tissue work, things like that. And that tends to be where the most value is for therapy. And then on your own, hopefully you can maintain it just with some simple stuff. So you would never have a lot of our patients aren't doing, like, say you need to do 20 minutes worth of stuff a day. Not a lot of them are doing that because, like you, they won't do it. But they will do other stuff that they enjoy to do, like if they like to go out and walk or hike. So usually we can get them to a certain level, and then they can just maintain with normal activity. Yeah. Anybody else had physical therapy before? Yeah. It's interesting because I think it's easy to say, well, physical therapy is physical therapy, kind of like a commodity. But they're actually, the approaches throughout the clinics in town actually vary quite a bit, depending on where you go and whether you get more of an exercise-based approach or the hands-on approach. We're a private clinic, so I would say we're a little more in tune with what's valuable to our patients. So, like for instance, has everyone ever gone to PT and they give you the same exercises every time and they watch you do them and then you go home? Like, it doesn't happen at our place because people will not pay for that, and it's not valuable, and it's a waste of people's time and money. 10 years ago, maybe we could get away with it, but now it's like you got to take time off work, you got a busy schedule, you maybe have a copay. A lot of our patients are paying their deductibles down, so we have to make their treatments extremely valuable and just know that they're they've got those things. And it's the same way for me. Like if I want to go to a PT or a chiropractor, like they better make it worth my time, let alone money. But to me, like time off work is difficult with 2 kids at home too. It's like I'm not taking an hour and a half out of my day twice a week to do that unless they can really impress me. So that's what we try to do. We talk about it a lot. Yep. Any other specific questions for me on backs, necks? You could open up to shoulders if you want. You guys are all going to go for a walk now, right? Go down to the store and buy some cigarettes. All right. Well, thank you all for coming. I'll stick around. Thank you. And I'll stick around if anyone has questions that they want to ask individually. Thanks.